You're listening to Health Professional Radio. My name is Wayne Bucklar, and my guest today is Jack Heath. Jack's the CEO of SANE. Now, I have to say that's a title I always thought I should have. But Jack, welcome to the program.
Thanks very much, Wayne.
Now, Jack, SANE is not an organisation name that I've heard of. Tell us what it's all about.
Well, SANE Australia was created almost 30 years ago in Sydney, and it was a wet and windy night at the Teachers Federation Hall, and there were a group of parents and other people affected by schizophrenia who'd gathered, and it was organised by Anne Deverson and Mark Leggett. And at that meeting, a young man called Simon Champ stood up and said, "My name's Simon Champ and I have schizophrenia." And that really kicked off SANE Australia. So for almost 30 years, our work has been about how do we help people affected by mental illness lead a better life, and that's both for the individuals themselves, but also for their family, friends and carers, anyone else that's involved in their life.
I see. 30 years is a long history. Has the organisation changed much, or is it still pursuing those same objectives?
Yeah, so when we started, our focus was exclusively on schizophrenia, and then about 10 years on, we decided to take an approach of looking at mental illness right across the board. So that was when we actually adopted the name SANE Australia, and always aspiring to be a national organisation. We've been based out of Melbourne for the duration. We've also got a small office in Sydney, and we have one of our staff members up in Brisbane, but always seeking to try and help people right across the country. And I guess our work has been focusing on three things in particular. The first is how do we provide better support to people affected by mental illness? And we do that through a 1-800 helpline. We also have an online chat service, and we've got some SANE forums that we launched just over a year ago that are being used right across Australia. The second area is around the training piece, and this is where we're doing training around suicide prevention. We've been doing work about physical health issues for peer-to-peer training, also working in the media, training mental health organisations about how to deal with media. And finally, in the workplace, we've got a mindful employer program that's helping managers deal with emerging mental health issues in the workplace. And then finally, the third arm is around the education piece, and this is where we're doing providing information resources. We've got a very extensive website, also working in the area to reduce stigma, because that's a huge impediment both to people that have got mental illness, but also if we don't get help early on, it creates problems down the track. And finally, under that education role, we have an advocacy position, which is about how do we actually try and support reform, mental health reform that's going to deliver better outcomes for individuals affected by mental illness and also their families.
Now, Jack, we hear in the media a fair bit about mental illness these days. It kind of never used to make the media much. Is it an increasing problem?
Well, statistics suggest that we are having increased issues around mental health. I think where we've been particularly good, certainly from an understanding basis and reducing stigma, has been around depression and anxiety, and I think, Beyond Blue's done a phenomenal job around that. We, in fact, though, don't actually measure very comprehensively the extent of mental illness within the community, because one of the things that's really important is we need to track that over time. So, for example, yes, it's good if we've got a better understanding around depression and what are the signs of depression and where you go and get help. But at the end of the day, what we really need to see is that we've actually got declining rates of depression. So I think that's a big challenge for us across all the different mental illness categories. I think the thing for us with SANE, and we've always had a very big emphasis in terms of wanting to reduce stigma right from the very beginning, is that for those people who are down the sort of severe end of the spectrum, and obviously there'll be people with severe anxiety and depression included in that, but for other people that might be dealing with a psychotic illness such as, say, schizophrenia, or might have bipolar disorder or an eating disorder, we really haven't shifted the dial much in terms of increasing people's understanding and acceptance around those particular issues. So we still believe there's a huge role and need a much bigger investment in terms of getting that stigma reduced, because late help is always very expensive help in both human and financial terms.
It is indeed, and that stigma reduction is a huge task, I guess. It's in my mind, it's a bit like fighting a jellyfish. It's difficult to see where it is, and it's difficult to get hold of, but its effects are there nevertheless.
Yeah, look, I think you're right in terms of it being difficult to address, and this is why we've, for a number of years now, we've been advocating what you need to do is to have a targeted approach. So, for example, we know from research done in Australia and also in the UK that one of the biggest areas in terms of shifting stigma is within the mental health professionals themselves. Now, if you're working and you're spending, every one of your sort of working hours dealing with people who are unwell, and you don't get to experience them when they are well, then it's very easy to sort of form a particular view that this mental illness is here and it's going to be almost intractable. And certainly from the people that we've had contact with at SANE, we've got about 80 speakers who will go out and sort of talk about their experiences right around Australia, is often we find that the attitudes that have been expressed to people can be one of the most limiting factors. And I think of one person in particular, so that when she was given the diagnosis of schizophrenia and she went into the government organisation to sign up for her disability support pension, the person behind the desk says, well, that's the end of the road for you, isn't it? So I think we need to do a lot more in terms of reducing the stigma amongst mental health professionals. And this applies to people working in the organisations themselves, because there's always that case of the plumber that's got the taps dripping at home. And I think when it comes to mental illness issues, many of us in the mental health profession have still got a way to go in terms of reducing that stigma.
That's a very interesting perspective. You're listening to Health Professional Radio. My guest today is Jack Heath, CEO of SANE, and SANE Australia is a national charity helping all Australians affected by mental illness. Jack, changing that view within members of the profession themselves, is that something that's recognised as being needed inside the profession, or is it just an observation from outside?
No, it's increasingly being recognised within the professions. In fact, there was some great work that's been done by the Royal College of Psychiatrists over the past 12 months. And this is sort of looking a little bit more in the context of the importance of physical health considerations when you're looking at someone with a mental health condition. And I think what's happening is that we're starting to get professions who are, and again, these are people who are working incredibly hard. In many circumstances, they've got very limited resources to be able to deal with people. Also, particularly if you move into sort of the emergency setting, you've got very, very high demands. So I think it's a very stressful place to be working, but certainly different aspects of mental health professionals are now starting to look a little bit more in terms of their own practices, and also to related that in terms of looking after their own well-being, because one of the risks for us working in the mental health sector is that often we get so caught up and passionate about wanting to help people who are unwell get back into a much better place that we sometimes forget to look after ourselves well.
Yes, I believe that would be an issue. Most of our audience, 95% of our audience, are clinicians of one kind or another, doctors, nurses, allied health professionals. Many of them work in either acute care or in aged care. I've never surveyed how many workers we have in the mental health sector, so I can't give you any idea of that. What would your takeaway message be for the clinicians who are listening to us today?
Well, I think for all those clinicians that are out there, I would really encourage them to have a look at the SANE forums. Now, these are online forums where we're building a community of individuals who either have a mental illness themselves or people who are caring for them. And the reason why I think this is important for the clinicians is that these forums are providing a safe, supportive and moderated environment that enables people to find support from fellow peers who are dealing with difficult issues. So at SANE forums, if you're a clinician or a professional looking after someone, we recommend that you take a look at them and see whether or not the SANE forums is a place that you'd recommend the people that you're working with to actually pay a visit to in between when they're coming back to your professional consultations. Because what we've found there, for example, just to give you one story, there was a person was involved in a discussion with a few other people, and one of them said to look, I really think you probably need to go and see a psychiatrist to have a discussion about your situation. And the person responded, well, yeah, I'm not sure about that. What would I do and what would happen? And then other people jumped in and said, look, this is how it's most likely would go. Obviously, you need to get a referral. But these are sorts of questions that you might, get asked, and these are the questions that you might want to ask in return. And what was wonderful was that after the person had gone and visited the psychiatrist for the first time, came back and said, you know what, that was a lot easier than I was expecting. So for us, these forums are about trying to encourage people to seek help early on, but also to provide a supportive network in between those professional visits. And as I say, the forums are fully moderated 24/7. And so far, we've got extensive protocols in terms of if someone's obviously at risk or might be at risk of harming themselves, but a very, very safe and supportive community that could well help ease the burden, I think, for clinicians in between those professional consultations.
That's some excellent advice, Jack. And you've mentioned previously a website and a 1-800 number, but we haven't actually given them. Now, your website, I understand, is www.sane.org. What's the 1-800 number?
So the 1-800 number is 1-800-18-SANE or 1-800-18-7263.
And I presume for anyone looking for further information, the best place to go is the website?
Yeah, if you go to SANE.org, and also too, as I say, the SANE forums that you can get to from SANE.org. The important thing about those forums is that we've actually partnered up with over 28 organisations, mental health organisations around Australia in every state and territory. And so we're actually, our reach into the rural and regional communities is very strong. And that's why they can be an important resource, because we know that people living in those rural regional communities are only accessing mental health services at around a third of the rate of those people in the big cities.
Yes, the whole issue of mental health in regional Australia is a different topic for another day, but it is certainly concerning.
Yeah, and I think this is where we have to think, creatively. I mean, more and more people are coming online, even if they're even now in sort of remote regions. And so the thing for us is if we can provide a safe, supportive environment through technology where people can connect up with other people who might be not close to them geographically, but close to them certainly in terms of the issues that they're dealing with. Say, for example, a son or daughter with bipolar, if you can connect with someone else also in a sort of small country town, you can start to build up a relationship, and it's not going to get rid of the problem, but knowing that there's someone else there to share the issue with certainly reduces the extent of it significantly.
Indeed, it does. Jack, thank you for your time. It's been a pleasure being able to chat with you today.
Thanks very much, Wayne. I've enjoyed the chat.
If you've just joined us and you've just missed my chat with Jack Heath, the CEO of SANE, the SANE Australia is a national charity helping all Australians affected by mental illness. And the good news is we've got a transcript of our interview, so you can pop off to our website and read the transcript. You can also head to YouTube and SoundCloud and listen to an archive of the interview on those sources. Now, our website is www.hpr.fm, and the SANE Australia website, once again, was www.sane.org. My name is Wayne Bucklar. You're listening to Health Professional Radio.